Sticking around with us, studies show Mississippi has one of the highest rates of chronic obstructive pulmonary disease, better known as COPD, in the country. However, with early diagnosis and early intervention, further damage to the lungs can be prevented. And joining us now is pulmonologist Dr. Bobby Tullos with Memorial Health to explain this a little more. Thank you so much for joining us.
Hey, thanks for having me today.
Awesome. So first, Mississippi on the forefront and a lot when it comes to health, but one of the highest rates with COPD. How did we get here?
It's smoking. That's probably the biggest cause for COPD, emphysema development in Mississippi. But we also have to take into consideration the type of facilities and environmental exposures that we have with the different types of jobs that we specifically carry down here on the coast. But it's, for the most part, smoking cigarettes.
All right, and it's actually COPD Awareness Month in November. What are some common signs you should look out for?
Yeah, so if you've been a smoker for quite some time and you've got those recurrent respiratory infections, I'll see my doctor once or twice a year. I always seem to get the crud. He always says that I have bronchitis. I've been treated multiple times with steroids or antibiotics. I've had the cough with wheezing, some shortness of breath, green, yellow, brown, sputum production. That can all be very suggestive. And sometimes folks will say, I just feel like I'm not getting along as well as I used to, and I'm just getting more short of breath. And folks will say, that's to be expected. I'm getting older, but not taking into consideration that the fact that smoking has taken such a toll on them. So if you start thinking in short about, I don't have quite the exertion that I used to. I do wheeze every once in a while or make a whistling sound when I breathe. I do seem to have this chronic nagging cough that sometimes will have color to it. And yes, I've been a smoker for quite some time. You may have COPD.
Absolutely, and of course we know that it can damage the lung, but exactly what are some of the damages, I guess, that it can cause, or some of the risk when it takes with smoking in your lungs?
So we used kind of broadly COPD for chronic obstructive pulmonary disease, but with that is chronic bronchitis, but also we have to think about emphysema, both of which are irreversible diseases. We can help manage a lot of the symptoms associated with it, but sometimes we can't reverse that, significant damage that's done. We do have a lot of things to consider and try in terms of our medicines, but it is a limited thing to treat. So really, quitting smoking is going to be the number one thing. Seeing an expert for sure will help optimize treatment of the disease, and then explore any other options that may be out there beyond medications.
Absolutely, and Dr. Tullos, just like anything else, early diagnosis and early intervention always a help, right?
Yeah, for sure. So if you're not sure that you need to see a pulmonologist, talk to your primary care provider. Ask them, hey, I've been smoking for quite some time. Do I need to see a pulmonologist? Is there something that I need to be considering? And also in terms of lung cancer screening, is that relevant to me? Do I meet per the guidelines, the indication for that? So really, if you want to start with your primary care person, do that. If you feel like you need to see an expert, we're here for you.
Awesome. Dr. Tullos, thank you so much for joining us. We appreciate your time.
Thank you. Have a great day.
You too.